Hello, I am a Shiatsu therapist based in London and a researcher. Most of my research has been done with cancer patients. I have been volunteering for 3 years into hospitals, giving Shiatsu to cancer patients. And in that time, we have collected data for 3 research projects. One of them is my master's dissertation, which consisted in pain management for cancer patients with Shiatsu. Later, I will show the results of these research projects, but first I have to explain some of the norms or the conditions in which we have to work with cancer patients in a hospital setting. That's very important. Read the door sign, because at the door sometimes they say you must enter the room with an apron and with gloves.
Oh, in the hospital,
Yeah. Yes, in the hospital, because there is a hospital virus which is called Clostridium difficile, which is transmitted through the skin, so we cannot work with our bare thumbs. This is the standard way to do it, and you have to give Shiatsu like this. It's not only for us, it is as well for doctors and nurses. In that lesson, the patient suffers from chronic obstructive pulmonary disease, so he cannot lie flat. He always needs to be treated in a reclining position. Our first concern is the safety and the comfort of the patient. We cannot think that our way of giving Shiatsu is more important than the condition of the patient. Some patients cannot lie on the side or face down, so we'll have to work with them on the back. Some of them need a reclining position, especially if they suffer from lung cancer, chronic obstructive pulmonary disease, or sleep apnea. When giving Shiatsu to cancer patients, there are some contraindications and precautions we should follow. We should always avoid the cancer sites and any sites where there is metastasis. This is especially true when there is metastasis in the bones or in the spine, because the bones will be weakened. Any sites where patients have received radiotherapy should be avoided for at least 2 weeks, but it depends on the conditions. Sometimes it's much longer than this. Deep vein thrombosis is a total contraindication. We should also avoid nodules and any nearby joints which might be tender. We should of course avoid any areas with cannulas, PICC lines or any medical devices, and we should never treat patients with fever. With patients with lymphedema, in general, we should apply a very light pressure very slowly. Unfortunately, we are not allowed to film inside the hospital, so I cannot show you exactly how we work there. I'm going to talk about the results of my research instead. The first research project was done with 44 outpatients who received 6 Shiatsu sessions. To collect the data, we used a standard form in the world of complementary therapies when treating cancer patients, which is called MyCo. Michael asked for two concerns for which the patient would like to be helped with Shiatsu. As you can see, the first concern was pain, followed by anxiety. The improvement for concern number 1, as you can see, was 2.3 points on a scale of 0 to 6, which is about 40% improvement. Michael also has two open questions to ask patients how the Shiatsu treatments have helped them. Here are some comments. For my master's dissertation, I decided to do a research project on reducing pain levels in cancer patients with Shiatsu. The difference with the first research project is that this time it was done within patients. You can see the improvement or the reduction in pain in the column in green on the right, which was 4 points on a scale of 10. Patients were also asked to score the relief they had obtained from the Shiatsu treatment. 69% said they had obtained from considerable to complete relief. In only one treatment out of 44, there was no relief at all. I also noted down unsolicited comments by patients about the treatments. You can read there 2 of those comments. The introduction of Shiatsu in these 2 hospitals has been very successful, both in the sense of patient satisfaction and in the results of these research projects. So successful that it has been decided to create a postgraduate diploma in clinical practice for those Shiatsu therapies that might be interested. Thank you for listening to my presentation, and I hope it has encouraged other Shiatsu therapies to work in hospitals.